Hi everyone, we're back, and today the topic for discussion is spine works and spinal trauma. I wanted to try to make it as interesting as possible because most people are not that interested in hearing about the spines. Many times we use our spines and we never stop to think that the spine is in use. Here are a few examples. Here is this lady cradling her baby. Yes, her spine is in use. For one thing, look at the position that she's in. She's lying backwards, so the spine as we know it is very flexible. Then take the person underneath, bending over. Yes, the spine is very flexible, and she's bending over because of the flexibility of the spine. Then take the other person who is dancing. She's also making use of her spine. Now the spine is made up of different vertebral bones. Some of them are in the cervical area, some are in the thoracic, lumbar, sacral, and then there are four fused bones which make up the coccyx, which we count as one. There are discs in between which are very spongy and soft, which make the spine not only easy when you bend it, but it stops bone rubbing against bone. And of course inside we have the spinal cord, and it's very well protected by the cerebrospinal fluid and the three meningeal coverings, so that stops you from injuring your spine very easily. However, if you have a traumatic event, it might happen, and depending on the area of the spine that's involved, the trauma can be quite hellish. Some people never regain the use of their extremities. Some people do, some people don't. I'm going to share with you a story about someone I knew of several years ago. This was, there were two young girls. They were traveling together, and one was in the passenger seat and one was the driver. Well, the driver fell asleep, and the passenger was wide awake, experiencing the car turning over. When the car stopped rolling over, they both had to crawl out of the back of the car. Help came, and I call this a miracle story because they were transported to the emergency room. And the driver just had a few bruises on the forehead, but the passenger had a broken spine, not just anywhere. The cervical spine, she had like 3 fractured cervical vertebrae. It is a miracle that her cord was not cut. She was in the ICU for quite a while, for several weeks, and then she had to have a halo brace put in place. Eventually she left the hospital, and I have to tell you, she had no neurological deficits. She left walking, talking, eating like any normal person, and has had a very normal life. So I can only put this down to one thing, an absolute miracle, because judging from the area that she got injured, you would expect that she would have a very large degree of damage, probably because when patients have injury that high up in the C-spine, typically what happens, their breathing can be affected. I've just tried to introduce you to a halo brace if you're not familiar with them, and those are virtual screws that are put into the skull, and then there is a vest attached to it, and it stabilizes the spine while that patient is at home, which in her case she was sent home in this condition. And then there's site care, where they have introduced those burr holes into the skull. They have to be cleaned with swabs so that they don't get infection, and there's special clothing that they can wear. Of course, the doctor orders all of this, and it usually is that there's special tools also attached to the brace, just in case there is a reason to separate it, like if there is CPR or so to be done. I hope you've learned something from this, and you can just take the time to go through the rest of the site and just learn some more useful information about spinal injuries. Have a great day.